My name is Jen, and I'm a registered dental hygienist. And I've taken my passion for natural health and nutrition and combined it with my dental hygiene profession to create my practice, Embrace Dental Hygiene. Embrace Dental Hygiene is one of Windsor, Essex only independent dental hygiene practices. My specialty is oral disease prevention and promotion of overall health. I provide oral care designed to enhance your health on your terms. Our office is designed more like a spa than a dental practice to promote comfort to everyone who visits. But at the end of this presentation, I'll share some tips on maintaining oral health. But what I want to talk about today is connecting or reconnecting your mouth with your body. If you are on a health and wellness journey or simply just want to maintain your best health, the health status of your mouth and your teeth needs to be a priority. Oral disease is a precursor or a symptom of systemic imbalance or a condition. There's a significant disconnect that exists between the perception of your oral health and your systemic health. And somehow the mouth has been removed from that picture of overall health and wellness. The misconception or this disconnect is dangerous because it often leads to oral health being overlooked or ignored in your healthcare or self-care practices. And the result is disease. I've taken some stats from the oral health component of the Canadian Chronic Health Measures Survey that was done in 2010. And it states that periodontal disease and dental caries is the most prevalent chronic disease affecting children, adolescents, adults, and the elderly. And that in fact, dental caries affects 60 to 90%, dental caries is cavities, affects 60 to 90% of school children and the vast majority of adults in most industrialized countries. And among 5 to 17-year-olds, that decay is 5 times more common than asthma and 7 times more common than hay fever. 96% of adults have experienced some form of tooth decay and 75% have experienced gum disease. These things don't happen without a cause. And they're more than 90% preventable, yet it's become as common as the cold. More prevalent instead of less as our society develops, and we accept it as if it's normal, and we simply treat what could have been prevented. Prevention of oral disease starts by connecting our mouth and our body and understanding that dental disease doesn't have to happen, and when it does, it's actually making you sick. Your mouth is the portal through which you receive your air, your water, your food, where your digestion and your immunity begin. It's said that the mouth is the window to your health, and disease in your mouth affects your ability to be healthy. Tooth decay and gum disease are the result of an illness, but are often described as just a cavity or my gums bleed a little bit when I floss. This illness or oral disease is linked to systemic illness like cancers, respiratory disease, heart disease, diabetes, poor pregnancy outcomes, poor digestion, and there's more links being found every single day. Loss of teeth shortens your life expectancy, and it also inhibits your confidence and social development. There is no separation between what's going on in your mouth and what goes on with the rest of you. And then treatment is another factor because the common treatments for oral disease, like tooth decay, can start a life cycle of treatment and trauma. Filling a cavity doesn't fix anything. It's simply patching a hole that the disease made. And it doesn't address the disease process or fix the imbalance that created the cavity. It's a Band-Aid for a symptom, which means the conditions are still right for you to develop more oral disease like cavities and gum disease. Most dental work only lasts 5 to 15 years, at which point it needs to be repaired or replaced. And each of these procedures increases your risk for more decay and premature tooth loss. So not to mention it can be painful and traumatic. We need to focus on proactive prevention, supporting our body's natural ability to protect and heal itself, because it can and it will when we give it what it needs. If we identify developing concerns early, we can prevent the need for dental treatment and even reverse early disease. When we approach dental care from a whole body perspective and incorporate lifestyle, diet, habit, and nutritional modifications, we can protect ourselves from disease. And as your oral health care professional, that's my job, is to guide and support and educate you on how to achieve your best health, not just diagnose and treat disease. And we can do this by identifying your individual risk factors and designing a care plan to mediate your risk factors and meet your individual needs. And this starts with children as early as 12 months of age, so that their care grows and changes as they do. And at this point, I'm just going to go through about 10 really important tips in terms of maintaining your oral health. You may want to grab a pen or a pencil. These are also available to download from my website, embracedentalhygiene.com. These are healthy mouth, healthy body tips. So anything that is going to promote good oral health is also going to promote good systemic health. Diet. It goes without saying that what we put in our body is going to contribute to disease or health. What I recommend is that you eat a whole nutrient-dense diet, including fresh whole vegetables, fresh whole fruits, nuts and seeds, whole grains. These foods that are whole in nature are detergents, so they're actually cleaning your teeth as you're eating them, and they don't feed the bacterial process. Secondly is water, drinking enough water and hydrating sufficiently with 2 to 3 liters of water every single day. And what I recommend is choosing plain and not sparkling, because both of those can be acidic in nature. Rinse with salt water during illness or times of inflammation. It's one of the best and natural rinses that are available. Saliva. Saliva is your natural protection against tooth decay. It has minerals and proteins that are wrapping and protecting every tooth. So support a healthy amount of saliva. We do that by hydrating. We do that by trying to breathe through our nose as opposed to our mouth. Using a lozenge or a gum sweetened with xylitol at times when your mouth feels dry. Or be aware of medications and conditions that can cause dryness. Carbohydrates. Avoid frequent snacking or sipping on foods or beverages that contain carbs. It's a common misconception that simple sugars or refined sugars are the only dangerous foods when it comes to oral health. Carbs in refined form are just as dangerous if consumed frequently. Acids, that's something else that's very, very dangerous for oral health because it can thin or cause erosion on the tooth material, and the hard tissue it doesn't regrow. So you want to limit your exposure to acids and harsh abrasives. So things like coffees, teas, fruit juices, even kombuchas and lemon water are acidic. So remember, it's frequency, not quantity. So small frequent doses are dangerous. Shooting your lemon water quickly and then not having water with lemon all day long is your best bet. Choosing clean oral care products. What I mean is avoiding products that contain chemicals like sodium lauryl sulfate, triclosan, artificial colors and sweeteners, bisphenol A. These are all ingredients that are in a lot of the common tooth care, oral care products. So choose products that don't contain those. Effective oral care. And this is going to look different for every single person. Not just brushing, not just flossing. You want to clean your tongue, clean your teeth, and master the art of gum massage, because you want your gums to hug your teeth like a toned, tight muscle to protect them. Bleeding and tenderness of the gums is always a sign of disease or injury. Stress. Manage your stress. And that's going to be different for everyone. And basically, stress exacerbates any kind of illness, including inflammation, including tooth decay. Vitamins. There's vitamin support for every condition, whether it's gum health or whether it's tooth decay. So what you want to do is consult with your professional regarding supplementing with vitamins like vitamin D3, vitamin K2, coenzyme Q10, vitamin C, and oral probiotics. That's a pretty new idea that's coming out to help support oral health. These can be key in supporting or achieving good oral health. And find a professional who provides care that aligns with your lifestyle. Have regular professional oral care, including teeth cleaning, and dental care for children, again, should start at 12 months of age and continue at 6-month intervals unless otherwise recommended. And you can find me in Amherstburg at Embrace Dental Hygiene. The address is 174 Sandwich Street South. I also have a website, embracedentalhygiene.com. I'm on Facebook. I have an Instagram page. But there's a free consultation available to anyone who has questions about their oral health or is looking to optimize their health or a specific concern. The phone number to the office is 519-736-1100, or you can email jen@embracedentalhygiene.com. Thanks so much for watching, and I look forward to meeting you. Anyone booking a new patient exam can reference this video, and they can choose a free oral care product under a $15 value from the Oral Health Boutique at Embrace Dental Hygiene.